Hello, my name is On, and I'm a junior doctor working in Southend University Hospital. I'd like to ask some questions to Dr. Bharat Pankhania. And the first one is, what is long COVID, and how do people know if they have long COVID?
So thank you. Long COVID is not very precisely defined, but roughly speaking, I would describe it as follow. Rather than it being defined, I will describe it. It's more a description. So it is a persistence of not feeling well after a coronavirus SARS-CoV-2 infection, i.e., COVID-19 disease. The range of signs and symptoms go from the following list. The person feels extraordinarily unusually tired. They may also present with persistent shortness of breath. They may present with palpitations of their heart. They may also present with loss of memory, poor agility of their brain, poor agility with remembering names and putting together succinct sentences. They often describe it as a bit of a brain fog. Then going further, some people also present with gastrointestinal disturbances, and some people also have renal problems, i.e. problems with their kidneys, and also some people have problems with their blood system, the system that makes the red and the white blood cells and the other things that make your blood wholesome. So in summary, long COVID is something that we're getting to know more about every day. It isn't a precisely defined definition of what is long COVID. Suffice to say, it is a prolongation, i.e., a continuation of feeling unwell 3 months after recovering from your COVID infection.
Thank you very much. When should people see their GP about symptoms persisting after their COVID infection?
So if people have a continuation of feeling generally unwell, out of sorts, vague but unusual, unexpected, not normal for them signs and symptoms after their COVID infection, and it hasn't gone away within 3 months, then at about that time, it is a good idea to also register the facts with your GP so that your GP can note it and see what is going on and follow you up, and then consider what interventions we can do for you.
Thank you very much. Is there anything that patients can do to ease their symptoms of long COVID?
So at the moment, we always say it is treatment is symptomatic. In other words, if you've got aching limbs and things, one, rest, and two, have a good diet, and three, do slowly building up of your exercises and walking and abilities, and take some symptomatic pain relief like paracetamol or aspirin. So there isn't any one specific treatment, but the generalized way to getting better would be to slowly build up on your exercise, to have a good sleep, to have good nutrition, and be well in your mind, physically, psychologically, spiritually. And we hope that for most people, the symptoms, although they have persisted, will eventually subside. We haven't found a magic cure for long COVID. So I am very concerned that we don't get infected and end up with long COVID.
Thank you. And finally, does long COVID have similarities or resemblances with other infections at all?
Yes, indeed. So we've always been aware of something we call post-viral fatigue syndrome. So what that is you have an infection, be it something like influenza or similar, and then after that viral infection, you are left with just feeling tired, worn out, out of sorts, nothing specific, nothing pinpoint, but just run down. So we're well aware of, infections and post-viral fatigue syndrome from viral infections, Epstein-Barr virus, influenza virus. All these are similar. People may also be familiar with something we call ME, myalgic encephalitis, which is, we think now, a post viral fatigue syndrome. So, yes, in answer to your question, we have come across this before with regards to recovering after a viral infection. What is different with COVID 19 disease is that the range of signs and symptoms seem to be more extensive, and they also seem to be what we would call um, longer lasting. So we can understand and explain damage to the lungs, but we also feel in some cases there may be damage to other organs as well.
So how does getting vaccinated affect a person's risk of getting long COVID?
That's a very important question because prevention is always better than the cure. I'm very despairing of what are we going to do with long COVID because we don't have a solution. So my solution to everyone is don't get infected. One way not to get infected is to be fully immunized. A fully immunized person is one who has had a full course of their vaccines. A full course of vaccines is two doses: one, a priming dose; a second, a boosting dose, separated by a minimum of 8 weeks. So, persons who are fully immunized are less likely to get long COVID. I'm not able to say persons who are fully immunized will not get long COVID, but I am able to say that a person who is fully immunized is very much less likely to get long COVID were they to get infected.